Hello, class. My name is Dr. Courtney Morris, and I will be your instructor for the 6-week online course with Bay Path University. A little bit about me. I've been teaching for Bay Path for almost 10 years. I taught on ground and then transitioned to teaching virtually. I also am a clinical health psychologist and work full-time in a primary care setting at a Veteran Affairs hospital in Massachusetts. I love the dynamic nature of my work clinically with veterans, and I also love teaching for students at Bay Path. This course is a really interesting overview of many of the primary mental health conditions or different psychopathologies that can arise in working with adults. We'll be looking at the different types of disorders. We'll be looking at how we currently clinically assess for these disorders. What are some of the most valid and reliable research methods to help us better understand these psychopathologies and mental health disorders in more depth? We'll be considering also the more up-to-date, multidimensional, and integrative approach to better fully understanding the impact of the disorder and how it's manifesting for an individual. All the different facets of cognitive functioning, neurobiological aspects, genetic contributing factors, environmental and culture, when understanding how it's been the etiology of the condition, but also how it's perpetuating in this individual's day-to-day life. We'll be getting in depth as best as possible in a very short amount of time. If you're new to online courses with Bay Path, there's some considerations to keep in mind. No late work can be accepted weeks 1 and week 6. Only late work can be accepted within a few days, up to Wednesday following, with communication with the professor. And then there are about 30% points deducted when assignments are submitted late. It's really fast-paced and we want to stay on track. A lot of the material builds upon the other as well. We will be asking for you to provide an original response to the discussion post question every Thursday night at midnight. And then by Saturday at midnight to respond to at least 3 peers' posts with different ideas and questions and considerations. Please don't forget to include empirical research and literature to your writings on the discussion board as well as your assignments, and to check the rubrics for each of your discussion posts and assignments for that week to make sure you're including all the most pertinent information for that assignment or discussion. This week we'll be mainly focusing on assessment and development, cultural aspects of understanding the different mental health disorders. What do we consider abnormal, not and normal, and the difference? And so we'll be examining this in more depth, both with the discussion post and with the 2 assignments. Also, throughout this course, we'll be having you choose a mental health disorder that you want to get more in depth with and greater understanding around. And we'll have different focuses for that mental disorder to better understand it, to then help you prepare for a final paper the 6th week of this course. So you'll have your first assignment choosing that disorder and better understanding the diagnostic manual criteria, the DSM-5 diagnosis more accurately for your assignment this week. We'll also have you examine societal mental health stigmas this week, and how some behaviors can be seen normal in one culture, but then in another quite abnormal. So for your discussion post, you'll be asked to look at 2 different types of behaviors amongst 2 different cultures, and how some things can be presented very differently in one society versus another on what's considered an issue or mental health condition or not. And then again, with one paper looking at stigma of mental health around one condition in particular, and the other assignment choosing a disorder you think you might want to focus on throughout this course. What's lovely is there'll be different aspects of applying your knowledge throughout this course, and there'll hopefully be a lot of shared learning on the discussion posts. Please don't hesitate to reach out to me with any questions. My email address is the best way to reach me, which is comorris@baypath.edu. In addition, I can definitely make myself available for any kind of Zoom meeting or telephone conversation if you'd like to get into a little more depth with a concern or question outside of the email correspondence. There is a lot of material we'll be covering, and it's a great overview of our best understanding to today's date of best practices and treatments for mental health conditions, as well as the main mental health conditions that we see in today's society and how we've become to better understand them. I look forward to working with you over the next 6 weeks. And again, don't hesitate to reach out if you have any questions. Thank you. Bye-bye.